Good morning. Happy Monday, on my way to clinic. Just had the classic thing happen where I went in to go talk to a patient who was here for a cough, interviewed him about the cough, asked if there's anything else going on at all, and he told me no. So I was like, great, I'll report to the doctor. And then of course when the doctor comes into the room, he tells me that same week he fainted and had a bunch of other symptoms in addition to him fainting and being out for a good amount of time. Gotta love when that happens. Which is basically a sleep disorder that explains what a night owl is. So it's people that can't go to sleep at the standard sleep schedule that is usually set by society. So say you go to bed at 10 p.m. and you wake up at 6 a.m. I could never do that. I can go to bed at 2 a.m. and then wake up at 10. Those are my peak productivity, peak sleep quality is if I go to bed at 2 and wake up at 10 and start my day that way. And the people that have this disorder are able to function normally if they just get the right amount of sleep in those hours that they're used to going to bed. Anyway, the reason I'm saying this is because I got a UWorld question on it today, and I learned about this previously, but I think me getting the UWorld question now and me now being awake at 3 in the morning, I'm just that's what it is. That's what I have. I can't wait to spend another 8 hours in clinic on less than 4 hours of sleep. I'm feeling really tired today, but I took a peek at the patient list yesterday and the day was way emptier than it was yesterday, so I hope that it's going to be an easier day. Another day, another bagged salad. Today has so far been the same as all the other days that I've had here. Everyone's basically coming in for upper respiratory symptoms. A couple of MSK patients later. There's one interesting patient that we had. We saw them yesterday for a potential norovirus, but then today they came back because the blood work came back and the only thing that was elevated was the white blood cells, specifically the neutrophils, a good amount, and we are thinking diverticulitis. That's my exciting patient case for the day. It's lunch now. I've just been intermittently working on Anki, answering emails, doing a little bit of research stuff. I'm thinking of going on a walk, but it's freezing outside. I'm falling asleep and running out of energy. And then the rest of the day, we only have 3 patients left, and they sound pretty interesting. 2 of them are going to be MSK complaints, which I really like the musculoskeletal system, and since everybody here has just been upper respiratory infections, it's nice to have something different for a change, so I'm hoping for a little bit more of an interesting second part of the day. I fell asleep working on research in my bed around 7 p.m. and I thought, okay, if I fell asleep at 7 p.m. maybe I'll be one of those people that gets really restful sleep, sleeps for 12 hours. I'll wake up at 7, it'll be perfect. I'll get a very restful extra hours night of sleep and wake up in time for work again. And instead I woke up at 10 p.m. wide awake, and now I feel like I potentially made my sleeping disorder worse. First patient of the day, annual well visit and a PAP. Patient 3 was a rule-out respiratory infection. Patient 3, a rule-out respiratory infection. There has been so much flu A going around and norovirus, so keep that in mind when you're around a lot of people and in public places. Lunch break ended up being really long because we didn't have any patient for the hour leading up to it, so I basically had a 2-hour lunch break. I may or may not have fallen asleep for 10 minutes by accident. Now we're back, and our schedule filled up. The day always starts off with like 3 patients on the board for the 8 hours that I'm here, and then slowly there's more and more calls and more fill-ins. So now it's going to be almost back to back until 5 p.m. I was really productive with UWorld questions today. I hit some sort of UWorld high. Now I have 250 Anki cards. That's my next challenge. After I complained about being bored, I just saw a patient who had a car accident and an incidental finding of a potential choroid plexus papilloma or carcinoma / meningioma / brain metastasis, but I think they're leaning towards a solitary tumor, and he's actually going in for neurosurgery next week, so he was here for clearance. That was very different than the upper respiratory infections that I've seen for the last 2 weeks. Patient 7, another flu. Freedom! Good morning, it's Thursday. Today's didactic day, so have a couple of meetings today and no clinic because of that. So the plan is to go to a cafe and meet Alex there to study once he's done with his little half day of clinic. So I'm looking at the things that I wanted to do today. Apart from the usual Anki UWorld TrueLearn trio, there's an outline that I'm working on for a new research thing that I should probably try and get a lot done today. And then the only other big thing that I have for today is working on my list of aways and potential residency programs. I have a networking event next week, fingers crossed that it'll still happen. I want to have a more or less solidified list of maybe a top 50. So in case the program directors or anybody from those programs is there at the event, I have the chance to talk to them. I didn't realize how useful making a table of all these programs was actually going to be. I was just gonna pick a geographical preference and just apply to every single program spanning out of that one city that I want to be in. But having an Excel sheet with all the important people and their emails, how many residency spots there are, whether they have a CT fellowship, whether they have a trauma center, do they do transplant there, just things that I kind of was interested in, and to have it all in one organized sheet is very nice when comparing programs and seeing how I want to rank it. So hopefully this also makes my life easier moving forward. I'm also definitely starting to fight some sort of cold or virus or something. I woke up congested, and I think I still sound congested, and with all the flus and whatnots that I'm seeing in clinic, my body's literally trying to fight off all these numerous diseases right now. I'm working on the book chapter that one of my friends was so gracious as to share with me, and with that hopefully I get to be the first author on this one, which will be really nice as I very much need publications to get into a good residency program. But I'm currently working on that right now. I'm 500 words in, give or take, and it's supposed to be around 1,500, so I'm a third of the way in. Help me coffee. I only had 4 hours of sleep again last night. I had another peds patient today. Probably total have only had around 10 peds patients in my entire time in my clinical year. Also because I haven't had OB yet and I haven't had pediatrics yet, but they're always so cute, and trying to get their history throws me for a loop because I had a little 6-year-old today. So of course she can tell me a little bit about what she's feeling, but once I start throwing the big words at her, right, like even something like fever, she probably doesn't even fully understand what a fever is and what it feels like. So it's really interesting to have to tailor the way you talk to them and the way you ask them questions. But I love them, they're so adorable. And then I also gave my first shot today, first time doing it on not a clementine and not at school. I gave a Solumedrol shot into the deltoid, and that was, I mean, very easy and fun. That first one. Done with patients until around 2:20. It's 12:40 right now, so all this time I have to study, so I'm gonna do a UWorld set. After working in primary care, I realized how many generic to brand name conversions I don't know, so I printed this, and I found this on CVS. 5 pages. Alex's first yoga class. Okay, Alex. Your genuine thoughts.
That was so hard. My legs are shaking.
Yeah, good workout.